The triangle of auscultation is a triangular space located in the back of the trunk. It is present on either side and it is bounded medially by the lateral border of trapezius, laterally by the medial border of scapula, and inferiorly it is bounded by the superior border of latissimus dorsi muscle. And this triangle lies on the 6th and 7th rib and the 6th intercostal space and the rhomboides major muscle. The clinical importance of this triangle is that when the patient is asked to cross their arms and lean forwards, this triangle becomes subcutaneous, and it's easier to auscultate the respiratory sounds of the apex of the lower lobe of the lung on each side. And on the left side, the cardiac orifice of the stomach lies deep to this triangle, and hence when X-rays weren't used, the sound of the swallowed liquids were auscultated over this area in order to diagnose esophageal tumor.